Coroner Medical Centre has asked you to watch this video, which tells you more about angina and the treatment that you'll be receiving. This is important because the aim of angina treatment is to help you control the pain and enjoy life more. It is also important because good control of symptoms depends on close cooperation between the doctor and the person with angina. The more you know, the better.
Yep, that's the sequence we want. That's good. Well, we probably don't have to tell you that angina is associated with heart disease. The heart is a very strong muscle which keeps pumping blood around the body at about 70 beats a minute for every minute of our lives. And to keep up that pace, it needs plenty of oxygen, and that means a good blood supply. The heart itself isn't fed directly by the large volumes of blood which it's pumping, but like every other muscle, its oxygen comes from arteries within the muscle tissue, which branch and divide to reach every heart muscle cell. The arteries which feed the heart muscle branch off the body's largest artery, the aorta, just as it emerges from the heart to carry oxygen-rich blood around the body. Now, our ability to exercise or to undertake any physical activity requires a balance between the need for oxygen and the amount of oxygen reaching the heart muscle. When we're young, our heart has the capacity for supplying sufficient oxygen-rich blood for the normal activities of everyday living. However, as we get older, there are a number of things which can reduce our heart's capacity to provide sufficient blood for our needs. Obesity, smoking and high blood pressure all put an extra load on the heart.
Yeah, face.
We often fail to exercise as we get older, and like any other muscle, lack of regular exercise can let the heart get out of condition. The heart's capacity to supply blood can begin to decline. As people age, the blood vessels in the heart can often become obstructed with fatty cholesterol deposits, which reduce the amount of blood which can flow through them. As the blockages increase, the ability to supply the additional oxygen required during exercise is reduced. And when this happens, any extra activity can lead to the heart being starved for oxygen. You're then likely to feel pain or severe discomfort, usually around the chest, sometimes involving the left arm and the lower jaw. And this pain is called angina. At the first sign of an angina attack, you should immediately stop all physical activity. You should sit still and give the heart a chance to catch up with supplying its own oxygen needs. When the heart catches up, the pain goes. Now, at first, angina may occur only in response to fairly vigorous exercise, but as the blockages of the arteries get worse, the number of angina attacks will increase, and the ability to undertake even simple tasks becomes more difficult. Of course, if the blood supply to an area of the heart is suddenly and completely blocked by a blood clot being caught in the narrowed blood vessel, the heart can be permanently damaged, and this is called a heart attack. People who have very severe angina, of the type which carries a high risk of heart attack, may need some form of heart surgery. But most people with angina will require medical treatment only. Many of those who have had surgery will also require medication at some later stage if further blockage of the arteries occurs. Now, there are a number of different types of treatment which are used to help people with angina, and some are not directly related to the control of the angina attack, but are used to reduce complications. Aspirin, for example, may be used in very low doses to protect against blood clotting and possibly reduce the chance of a heart attack. Anti-cholesterol drugs are sometimes used to try to prevent further blockages of the blood vessels, and these are particularly important following heart surgery. The main treatments for angina, however, are aimed at the blood vessels and the heart. If the heart's demand for oxygen is too high for the partially blocked arteries to supply, there are two possible treatment approaches. Reduce the demand for oxygen by slowing the heart, or increase the supply of oxygen by widening the blood vessels. and both of these methods are used. Now, the easiest way to reduce oxygen demand is to cease all physical activity, but this isn't really an option if one's going to enjoy an active lifestyle and a good quality of life. But there are three classes of drugs which are commonly used. And these drugs work by either reducing the demand or increasing the supply of oxygen. They are the beta blockers, the calcium channel blockers, and the nitrates. Now, beta blockers slow the heart rate, reduce the amount of work the heart muscles do, and lower the blood pressure. Calcium channel blockers reduce the pressure against which the heart pumps, and they can also enlarge or increase the size of the blood vessels in the heart and slow the heart rate. The nitrates are very commonly used for angina. They enlarge the blood vessels and reduce the pressure against which the heart pumps blood, in effect, reducing the workload on the heart. The best known of the nitrates is glycerol trinitrate. Oh, thanks, Tony. Now, this is very quick acting, and it's usually prescribed as a tablet to be put under the tongue during an angina attack. No matter what other agents are used in the treatment of angina, glycerol trinitrate is used to treat the acute episodes. It's very effective and quick acting, but not really suitable as long-term protection against future attacks. No matter whether it's used alone or in combination with other drugs, the number of times a day glycerol trinitrate tablets have to be used should be monitored. Now, if the need to use these tablets increases significantly, it's often a sign that it's time for the doctor to review the treatment. Angina attacks can be prevented from occurring by taking regular doses of longer-acting nitrates. Some products are in the form of transdermal patches, which deliver the nitrate through the skin. Some products are in the form of tablets, which are taken 2, 3 or more times a day, while one of the latest long-acting agents is given only once a day. But in each case, the aim is to keep the levels of the nitrate in the bloodstream high enough to maintain the enlargement of the blood vessels. It would be ideal if we could keep the blood vessels wide open 24 hours a day, but the body simply won't cooperate. If we use the drugs continuously at high doses, the mechanisms which keep the arteries open get tired or used up, and the drugs start to lose their effectiveness. Now, this is called tolerance, because the body has learned to tolerate the drug and no longer responds to it. Obviously, this is very important, as tolerance could reduce the effectiveness of the medicines we use. If we want our drugs to keep working and prevent attacks from occurring, we must allow some time for low nitrate levels each day to give our blood vessels time to recover. In this way, tolerance can be avoided. Now, if a patch is used, it often needs to be removed each evening to allow the nitrate levels in the blood to fall. However, remembering to remove the patch each night can be a problem. So how can we overcome these problems and still give you protection? Well, with all medicines, it's important to remember to take the medication exactly as your doctor prescribes. It's also important to take each dose at the correct time. You should take your tablets at the time of day specified by your doctor. If a patch, like this for example, is being used, it's equally important to check with your doctor how long each day the patch should be worn. It's just as important to remember to remove it at the correct time as it is to put it on. Now, if you forget, the chance of developing tolerance may be increased. If you're taking a once daily nitrate tablet, there's less difficulty. The once daily dose is usually taken in the morning. This type of tablet releases most of the active drug progressively during the day when angina attacks are most likely. This is achieved by a special delivery system which releases the drug at a precisely controlled rate. Now, as we explained earlier, even with long-acting agents, it may still be necessary to use glycerol trinitrate tablets to treat acute attacks if they occur. All of the nitrates have similar side effects. The most common one is headache, which is usually a problem only in the first few days of treatment. This is caused by the enlargement of the blood vessels in the head. Now, while this can be unpleasant and certainly a nuisance, it is a sign that the nitrate is working. If other arteries are enlarged, we can be sure that the arteries of the heart have also expanded. Other side effects, which can also result from blood vessels enlarging, are flushing or reddening of the face and low blood pressure, usually experienced as lightheadedness. With nitrate patches, there may also be the problem of local skin irritation due to the glue. Now, if you're using any of the agents we've talked about, you'll realise that they're intended to reduce the number and intensity of angina attacks and to allow normal daily activities. While not giving you a new heart, therapy with long-acting agents should allow more enjoyment of life with a reduction in the number of angina attacks and the need for glycerol trinitrate tablets each day. Well, what else can you do to help control your angina? Remember the factors which make angina worse: excess weight, smoking, and high blood pressure. You can do something if any of these apply to you. Eat a sensible low-fat diet. Plan your activities within your capacity and try to avoid sudden physical or emotional stress.
Hi, Bobby!
Now, there's one more important thing you must do. Treatment of angina works best if you get regular advice from your doctor and follow it. See your doctor regularly. And if you're taking a long-acting agent, remember to take it exactly as instructed by your doctor or pharmacist.
This tape has a lot of information on it, so you may wish to view it more than once. Please do so. But remember that others are waiting to see it, so don't keep it too long. Make notes of anything you don't understand and ask those questions when you return the tape to Warriner Medical Centre.